Good afternoon. Wednesday, July 1. Let's go through some numbers first for the COVID-19 pandemic. As of today, in the state, we've had 14,990 positive tests, which is an increase of 547 cases since Monday. That, and you may recall, is superimposed on from Monday of this week to Monday of the prior week. That was almost 2,000 cases. So from Monday of last week until today, that represents essentially 2,547 cases for the state of Kansas. This is a significant increase and clearly another step in the wrong direction. We've had 168,183 negative test results and 272 deaths, which is an increase in 2 since on Monday. I wanted to talk a little bit about the numbers, and that's why I have this graph here. You can clearly see, and I brought a pointer, that this starts on 15 March and goes up until about a week ago. And the reason I wanted to bring this out and bring this up and point it out to you is that this curve where we show an increase to a peaking out at the end of April and then down and then coming back up, it's not random. This is something that's predictable. And unfortunately, the decisions that have been made have contributed to this. And let me go through some of those. You'll recall back on March 16th was a school closure date. One incubation period later, 14 days, March 30th, stay-at-home order put in place. Both of these in the state of Kansas occurred relatively early compared to other states in the United States. 2 incubation periods later, 28 days in other words, we reached the peak at about right at the end of April. Entered shortly thereafter on May 4th, entered phase 1 of the reopening plan. Progressed with a very nice downward trend line. Entering, we didn't feel quite ready, as you recall, to enter phase 2, so interpolated a 1.5 phase, continued good decrease. And then this is where things start going sideways. On May 27th, you recall the compromise bill resulted in the state reopening plan becoming guidance and not a mandated plan. That was right at the very bottom and in an ideal world, we were supposed to gradually have this continue to tail off so that by July 1, we were in a low point and going to have a nice summer and build up our PPE stock and then prepare for the autumn and winter onslaught. Unfortunately, by this becoming guidance, that's when many counties opened up and started. Many just returned to business as usual, and particularly with the opening up of mass gatherings. You'll recall we're still in phase 3 now by this guidance that we've provided, which would have us with no more than 45 people. But that is merely guidance and at this point. Okay, so we superimposed May 31st, Memorial Day, which we saw everywhere with mass gatherings throughout. Now, some counties were very adherent to the Ad Astra reopening plan, to their credit. Some even had their own county plans, which were a good deal more stringent, and to their credit. That's why we've continued throughout the state to see spikes in some areas and less so in others, and we'll come to some outbreaks in a minute. And this hasn't materially affected us yet, but I want to get it on everybody's radar because it's critically important. On June 4th, in the special session of the legislature, House Bill 2016 passed. And there's provisions in there that are going to be a problem for stemming the tide of this COVID-19. And that is, in that bill are impediments to doing contact tracing. Now, really 2 things of substance. One is there's very specific language about not using technology such as GPS for tracking people, and it was the concern was of privacy, that would be imposing on the privacy of people. We had no electronic tracking going on, and we had no plans for that. So that's not the issue. The issue is that it changes the way that we can do contact tracing regarding third parties. That's defined in the bill. I'm not a lawyer. I'm not going to interpret that for you right here. But let me say is what it does is it talks about third parties. For example, if we would go into a business and say to them, you've got workers that have been infected. They don't even know who they were working close. Your human resources department has that. We would love to know that so that we could call the folks up and let them know they're at risk and then continue to monitor them for the next 14 days. This House bill requires us to make rules and regulations that will, I have no question about it, will interfere with contact tracing. And I'm going to summarize where that fits into this story. So in summary, key decisions along the way that have stemmed the tide and come back down to an improvement, and things that have happened along the way that have made it, and I predict that not only will we see this trend line, but it'll steepen, and because that's how, and especially if we have a difficult time doing contact tracing. So, clusters. As a state, we have seen an increase in 11 clusters since this past Monday, which is a cause for alarm. In total, the clusters we have account for 6,484 cases and 205 of the deaths. I want to focus on the active clusters that we have going on in the state right now. Some of them have been contained and are no longer active, so let me talk about the active ones. Private businesses, there currently are 41 clusters with 429 cases. Long-term care facility, 26 clusters with 356 cases. Gatherings, 14 clusters with 148 cases. Meatpacking, 9 clusters with 2,975 cases. Group home, 5 clusters, 49 cases. Healthcare, 5 clusters with 29 cases. And again, relatively new on the scene is sports. We now have 4 clusters with 29 cases. Daycare or school, 3 clusters, 13 cases. And corrections, 1 cluster with 5 cases. So one of the things we're finding, and again, it goes back to what I'm talking about the prohibition or the guidance against mass gatherings, is that when we have cases that when we have clusters that then become no longer active, then we have new ones come in the door that we have to start working with. So these current numbers that we have, 4,033 active cases are related to these clusters, show that the virus is not gone, as would be confirmed by the growth on this chart, nor is it planning to take a break over the holiday weekend. Good news, over this past weekend on Saturday, we've talked about the mobile van that we have now for sampling and testing. We took it on the maiden voyage this past Saturday, went to a community clinic of underserved individuals that I think is quite highly likely would not have found their way into evaluation and testing. So we did 250 tests in those individuals, and 13% of whom were positive for the COVID-19 virus. And then on Monday, we're dispatched to one of our state hospitals because of an emerging cluster there with 250 people being tested. Results yet to, I don't have the results in front of me from that yet, but will. Testing capacity nationwide. I've been speaking to you with an optimistic tone about the amount of testing we're able to do in the state. And that's still true in our Health and Environment Lab, but we know that the testing nationwide is becoming strained. I was on a phone call yesterday with the hospital executives throughout, and one of the commercial labs that is what we would call a high capacity lab, now who used to turn the test around in 2 days or 3 days, now has such a high number of tests coming in that it's more like 4 days and 5 days, which is an ominous indicator for the overall testing, and that's happening throughout the United States as well. Okay, different topic, travel quarantine. This week we added 2 new states to our travel quarantine list, South Carolina and Florida. The comprehensive list of those individuals needing to be quarantined for 14 days include visitors in Kansas who have traveled to those states, South Carolina and Florida, on or after June 29th, and this information is all on our website. Alabama, Arizona, and Arkansas on or after June 17th. been on a cruise ship and river cruise. We've talked about that forever since March 15th, and international travel on or after March 15th. Why are we so focused on quarantining individuals that come from high prevalence state? And that is, we have a hard enough time eradicating the virus within the state of Kansas that we have now. We really have to be careful to not import COVID-19 from the state of Kansas into the state of Kansas. We've got a lot of questions about where this, how do we decide on what states to add to the list? States added are determined on, by evaluating new cases, the rolling average over a 2-week period. Again, that's the incubation period for the virus, and then adjusting for population size, giving it on a case per 100,000 population. This then can be compared to the rate for the state of Kansas. And what we've done is we've set 3 times the rate per capita as the threshold. And that's where the, at any given time we'll have 6 or 7 on there that are up to, that are 3 times greater the rate per capita compared to Kansas. And I bring that up because at a time when New York was very hot, very much a hot spot, they were 12 or 13 times the rate of Kansas. If we lowered it to 2 times the per capita rate for the state of Kansas, that would be around 30 at any given moment, 30 states, which really becomes impractical and would almost say, why would we do that? So it's been a natural break at about 3x, about 3 times the per capita rate. And it's always hard to know how successful it is, but we do know that we have tracked back patients who have the disease, who have the illness, that have acquired it out of state. We do know that from our contact tracing. Masks. Since the governor's executive order has not yet been released, I'm not going to speak to masks today. I can talk to you about science if you want to do that, but I'm not going to talk about the specifics in the executive order because that will come out tomorrow. But I do want to offer a few observations. I recognize at the beginning of this pandemic, the guidance about mask wearing was confusing and inconsistent. This is attributed to the fact that, one, it's a new virus, but secondly, because there was PPE shortages and we did not want to divert masks from much needed hospital personnel and first responders to those of us just in the public that were at that time at relatively low risk. Now, months later, the evidence is a good deal clear, and by the way, we've always known that masks work. But it's really important to stick with the evidence and what we know. As the governor mentioned on Monday, when we look at where we are seeing clusters of cases, we are not seeing them in businesses where masks are being worn. We have no clusters attributed to barbershops, hair salons, and dental offices. We are seeing a significant increase in clusters related to gatherings where masks are not being worn, bars in particular. Your mask protects me, my mask protects you. If we want a healthy Kansas economy, we need healthy businesses in healthy Kansas. Masks will help keep businesses open. Masks will help keep schools open. And if you're confused about what county am I in or what state am I in, you shouldn't be confused about what state, you can't go wrong wearing a mask. So, we have a bad convergence ahead. We're in the middle of a bad convergence, 10 days, 2,500 cases. That's evidence enough. But why am I concerned and why am I calling this a bad convergence? The essential approaches to winning the battle of COVID-19, of course, ultimately is antiviral medications and vaccine, but we don't have either. So the essential approaches to COVID-19 are: 1, adequate testing capacity. We've increased our testing capacity terrifically, but I just gave you earlier, and that came also from Health and Human Services testing czar, Admiral Brett Giroir, talking about the nationwide, I wouldn't call it a shortage yet, but a nationwide concern. So adequate testing capacity is one of the essential approaches to COVID-19. Number 2, rapid case investigation. When we find out that there's a positive case, we investigate and find out information about that person. We're okay for now on that. 3, contact tracing, aggressive contact tracing. You've heard my concern about House Bill 2016, and that I'm afraid will drive roadblocks to contact tracing. I might add that the roadblocks that are put up in 2016 for contact tracing only apply to COVID-19. So, for example, we had a salmonella outbreak last week, and we might have a syphilis outbreak next week. And those are unimpeded. We will do the best we can and hope that we are not having our hands tied through this 2016-driven legislation. And finally, the fourth, isolation and quarantine. We're in good shape for that. We've seen people cooperate, and we have not had a lot of difficulties with compliance. So the essential approaches: testing capacity, case investigation, contact tracing, isolation, quarantine. So the solution isn't cure, because we don't have a cure for COVID-19. The solution is prevention: physical distancing, mask use, hand hygiene, surface cleansing. And one of the things I must say is that about 3/4 of the time with these clusters, somebody has come to work, or somebody has come to a funeral, or somebody has come to a party ill. It amazes me how many people know they're ill and blow by it and go to work or play or whatever they're doing. So stay home when you're ill. 4th of July. I'm worried about what we're going to see happening over July 4th, just like we saw during Memorial Day with the large gatherings. Do not gather in large numbers. While our 4th of July celebrations will undoubtedly be a little different this year, I want to remind everyone the importance of safety. Please remain vigilant. Now is not the time to let your guard down. You are your own preparedness. That's the end of my prepared comments. Happy to answer some questions.
Mr. Secretary, explain the value of an executive order on masks when counties can exempt themselves, and many will, when it's up to the local officials to enforce it, and many of them have already made it clear they're not going to. They're not going to cite people, they're not going to arrest people, they're not going to fine people. So what is the value of the governor issuing an executive order that arguably is pretty toothless?
Well, I think I do have that same concern you do, John, that there'll be avenues for people to skirt what is, I think, a really good plan. This is going to be not at all subtle of what we see here, especially as it steepens, and it will steepen. My hope is that people will learn, that they will see that guidance has been given that will be successful if it's adopted, and when the course they're pursuing is unsuccessful, that they'll change.
When you say that you're predicting that the rate of increase will continue to steepen, should we take that to mean that you feel like the mask mandate will not be successful in reducing the curve?
I think it will be successful to the degree that the people adopt it. Yeah. So I think, and because of that, it's a really good question. I think it's really important that people look at their respective county by counties, because there's going to be large gatherings planned in many counties, and I'm sure that the increase and spike in the number of cases will track to those counties.
Is there any authority you have to order masks or shut down the bars or something through your role as the state's chief health officer?
State health officer. Good question. What authorities does a state health officer? And I, as a state health officer, have statutory authority to shut down a gathering that is deemed to be unsafe to the public health, as does the county health officer.
And that's not anything that's to run through the county. If you go out and see
Right. Yeah.
4,000 people drinking, you can just say,
Right. And the county health officers additionally can shut down an establishment that is deemed to be unsafe.
do local law enforcement have to enforce that order you would make?
I don't know the answer to that, Martin. The question is, does local law enforcement enforce mine? In other words, if they were blown by local authorities, I'll have to find out that.
On contact tracing, you mentioned some potential concerns in terms of how House Bill 2016 will hamper you. Do you as a state have metrics established to measure the effectiveness of contact tracing throughout the state? And if so, what are they? And can you kind of give us a sense of how we're doing? And if not, does it feel like we should have a way of measuring how well we're doing?
Yeah, the question is, how does one ascertain the the benefit provided by contact tracing. And the answer is, we do know how many people we interview. We know how many people that are positive end up having, it could be anything from no contacts or a few contacts, and I think the record has been over 400 contacts for one particular individual. And we do, I don't know that we can put a grade to it like a B+ or something, but I do know that, and how we compare to other states. And for example, our testing rate now is 8% positives. You may, this isn't exactly the question you asked, but you remember New York now has put out some restrictions on people coming into the state and being quarantined and being fined and whatnot. And they put 10% or greater positivity of a state as one of the metrics, and we're below that at right about 8%. You don't know about the contacts, so you cannot know about the contacts that you have never been told about. And that's exactly why this concerns me with 2016, is because if we can't find out all those contacts, then they're free roaming, are gonna, without even an inquiry.
But you're confident, just to follow up, you're confident though that the increasing trend line is not simply attributable to just the increased accessibility of testing?
Increase what?
Greater accessibility of testing.
No, so is the increasing positive number of cases just due to increasing testing? And the answer to that is absolutely not. And the reason is because if it were just the dilutional factor of increasing testing with a stable number of ill people, the percent positive would be dropping. And we are down much below 8%, even as just a few weeks ago.
What exactly about the rules you have to draft, what about them inhibits contact tracing, just in general?
You mean in 2016?
Yeah.
The one that's and again, I'm not a lawyer, and there's some definitional things that have to be considered. It is the ability to use a third party to help gain information about a person and their contacts, whether they choose to opt in or choose to opt out with that.
So it allows a business, for example, to not say, you say, I need some information, and the business could literally say no.
Right. Now, back to Martin's question. So the question is, if a business would stonewall us, would that just be too bad for the process? And the answer to that is, one, we'd like to negotiate our way into helping them help their employees. Two, if they have a healthy workforce versus a workforce that has COVID-19 spread throughout, they're not going to be open for business anyway. So three, we would like to negotiate a peaceful way to do that. And actually, we have a great track record of it. When you look at the meatpacking, we were very helpful, and in some instances with some other businesses, we have had some pushback and just said, we are here to try to help you keep a healthy workforce. And that helps them stay in business. One more question.
You do have authority, make sure I have this clear, to order the shutdown
Of an event, yep.
parade and what you just call the organizer and say shut down?
We'd issue a mandatory order, and that would be carried out by law enforcement.
With all the
Okay.
increases, Secretary, do you think we're opening too much too fast? What's your opinion?
Yes, I think that the question is, did we open too much too fast? And I think that if we would have continued with the same measured approach, businesses would have been fine. And I think actually with the mask order, businesses will be fine. Where I think that we have led to the increased number of cases is in mass gatherings. And that's because we're still at 45 in phase 3, right? And so many of the counties have blown through that. Thank you very much.
So you think that it should have been around 10, 15 instead of increasing the numbers, and we probably wouldn't have had
The smaller would always be better in this.
Thank you very much.
Thank you.